have a look at the recordings. My name is Dr. Anita Khoso. I've given an introduction
You were
yesterday.
asking if we have questions to ask. Please, can you please post it when we are done the recording for us on WhatsApp?
I can. The recordings don't come to me. They come to they're on the cloud recording. So they come to the administration. So they're the one who can post things. I'm only allowed to send you the link as a reminder, but it is only them who access it, and then they give it in whichever group they have to give it. So you can write to them. So it's if you want the recordings earlier, I'll just mention it to you, admin@ukversity.co.uk. So they will respond to you. So most of them don't work on a weekend, so they will respond to you, however, on Monday.
Okay.
Okay.
Right. Thank you so much.
No problem. So this unit is a brief history of health. I hope my screen is visible to you. It's about health and how it started, and a bit about medicine, how it started. So it's a brief history of health and medicine. It has 2 learning outcomes only. Okay, so the first learning outcome, you can access it, where we talked about understanding the concept of healthcare in the 18th and the 19th century. Here, I summarized the patient knows best approach to medical treatment, which happened in the 18th and 19th century. So earlier, we had this concept that the patient knows best, but then this later on it changed into the doctor knows best. Okay. And then we went on to explain in detail how dissection led to practices that are now used in medical, which is the modern medicine. We evaluated the importance of the rise in laboratory medicine in hospitals and clarified what is meant by germ theory. So you can have a look at that presentation. Again, if you have any questions regarding that presentation, please feel free to reach to me. And then today we will be doing the learning outcome 2, which is to understand the changes in medicine that have been brought about, today's concept of doctors know best. Okay, so now there's a shift. So here we will summarize the way in which key individuals contributed to modern medicine. Louis Pasteur, we'll talk about him. Explain in detail how invention of key medical implements and machines advanced medicine. And we will analyze how the advances discussed in criteria 1.2 through 2.2. So 1.2 through 2.2. How they moved medicine from the domain of the patient to the domain of the doctor. Okay, so now it's more in the hands of doctors. I'll stop sharing here and I'll quickly share the presentation with you. I hope you can see my slide. So just a minute. So yeah, so this now I will discuss what I was mentioning you briefly. So we're doing learning outcome 2. This is to understand the changes in medicine that brought about today's concept of the doctors know best approach. So first it was the patient knows best, and now that approach has changed where it is now prevalent that the doctors know best. So we're going to talk about these things. So as you know that you will have an assessment at the end of every unit. So in this, you will have assessment where we will um, assess you on the understanding of the subject, your application of knowledge, use of information, communication and presentation, and your quality of work. So there's a QAA grade descriptors for detail of the components of each descriptor. Just a minute. So a bit about the key terminologies. We had talked about this yesterday also. Welcome, who's joined now? Martins, hello. Welcome to the session. We've just started it now. I've just given a brief overview of what this whole unit is about. So we are talking about the understanding of the changes in medicine that have brought about today's concept of doctors know best approach.
Okay,
So, yeah, welcome to the session.
thank you very much.
Welcome. So here we are starting on what is medicine actually. So we're talking about medicine, how it started, and how it evolved through the different stages. So medicine is the science and practice of caring for a patient and managing their diagnosis. So what is the condition? What is the disease? Prognosis is what is the outcome of the disease. So some diseases have a very bad outcome. For instance, it's cancers. Some diseases like influenza can have a good or a bad outcome depending upon the condition of the patient. So if it's a child, influenza might not be very favorable in that person. But if it's a strong athlete and he's just got a flu, that's fine. But in an older person, again, the prognosis or the outcome of that condition, that is a very small thing for a person who is healthy and young. For them, the prognosis is positive compared to a person who's very old. So this is how we see prognosis. We see different things in prognosis. What is the outcome of a condition? Then we talk about prevention. We know that prevention is always better than curing a disease. So by prevention, we mean how do we best prevent not only the disease itself, but also the factors that are causing the disease. For instance, we have smoking that causes lung cancer. We have alcohol that causes liver cancer if it's in excess. And then we talk about treatment. Okay. Medicine talks about treatment and relief of that your injury or your disease. So that is called palliation. And then that means that the injury or the disease has already happened. It's gone beyond prevention. Okay. Now, how do we best manage it so that it doesn't get worse? And then promoting health. And what is health? According to the World Health Organization, it is a state of complete physical, mental, and social well being. And it is not only the absence of disease and infirmity. So, initially, the World Health Organization had their own definition where they said health is just a state of physical, mental, and social well being. No, actually, World Health Organization initially said that the state of health is acceptable when there is no disease or infirmity. However, now it has changed. So you now consider physical, mental, and social well being. And now, in recent years, it has also gone up to uh, like not only physical, social, and mental well being, it is intellectual well-being, it is your religious well-being, it's a lot got it's got more of your social aspects that have been now a cause of disease. But when all of these are in harmony, this is when you call it completely being healthy. So a resource of everyday life, it's not an objective of living. And it's if health is a positive concept that emphasizes social and personal resources as well as physical capacities. So we've had different um, different scientists who've come through the years who've talked about medicine. So Louis Pasteur, for instance, is the father of immunology. Sorry, Joseph Lister, a bit about his history has been mentioned. You have these handouts that are present there on your Moodle website. There's a history of medicine that you can access the video whenever you are free. History of medicine in time, and misery to mirth. This is a very good article that you can read where there's recovery from illness in early modern England. Okay, so these are some of the key individuals who played a key role in health and medicine. There's a video on this. Please have a look at it. I'll just share the link with you. So what you can do is just access this link um, when you are free. Just keep it with you safe, and then when you have the time, because if I end this meeting, this video will not show there. So just have a look at this video. So we don't normally play videos on during our sessions. So it's for you to look at when you're free, when you have your time. It started already. Sorry. Sorry for that. Stop sharing. And Martin, I was just speaking earlier to the student. If you have any questions, please feel free to ask at any time. I've gone through the first learning outcome, which was completed yesterday. So the recordings will be shared with you on your Moodle page by tomorrow. Um, but if you have a look at it, I've made it as self-explanatory as possible. However, if you have any questions, please feel free to email me or send me any question in the link in the WhatsApp chat. Um, and then there's something else also for you to take home. So explain in detail how there are different inventions of key medical implements and machines that have advanced medicine. So there are these reading articles that you have to go through where there's advanced nuclear medicine through innovation. Then there's 15 medical inventions and discoveries of the 1800s that have come to define modern medicine, artificial intelligence for health and healthcare. Please do have a look at these. These reading articles are there on the Moodle website again. Have a look at them and read through them because they will be very important when you will be doing your assignments. And then medical devices. There's an ebook which has to be read on medical devices and how have they helped in throughout the processes. So now we go on to the last learning outcome where we analyze how the advances discussed in criteria 1 through 2.2 moved medicine from the domain of the patient to the domain of the doctor. So initially what happened that whatever was done according to what the patient the disease of the patient was. And so initially, if we go very, very back behind in time, it was the doctor who decided everything, the the drugs, when to take the drugs, how to take the drugs, um, which route to take the drugs from. So if it's oral, um, it had to be a tablet. If not, then there was no other option. But some people can't swallow tablets. It can be for any reason. So it was mostly doctor led. Okay. And later on, it became patient led. Okay. So they started incorporating uh, patient well-being into consideration. So what is the best that they want? So if there's a discussion on their treatment, you will then ask the patient, if you are caring for them, that what do they think is best for them? What do they want? How do they want it? So for instance, if there's a person who's come with a disabled arm, their arm, they can't lift their arm. What is it that they want? Is it if and they are in pain? So you ask them, if they're in pain, what do they want to achieve out of that consultation? Okay. So if they say that they want pain relief and they want to be free of disability, you then talk about options like giving medication, giving injections if the medication, oral medication, does not work, or then you go to the extent of even trying a surgery for that person if their disability is not being improved after physiotherapy. And when do they want the physiotherapy? Do they want it physiotherapy at their home, or do they want to come to the clinics? What time would they prefer? Is it early morning? Is it late evening? So things then go according to the patient, and then the health of the patients is more in their hands as well. This gives a feeling of independence. This makes them feel important. So the three advances in health and medicine are, so some of them, the top one include vaccines that were introduced in 1796. There was anesthesia, there's medical imaging, penicillin, and some modern day advances such as epidemiology, which is the study of epidemics and diseases. Where do you see the diseases? Where do you not see them? What is the reason why you see more diseases? Why don't you see more diseases in other places? The germ theory, I've talked in detail about it in the last session. Please have a look at it. Insulin, gene therapy, and 3D printing. There's a continuity of care and the patient experience. Please have a look at this. This is a very good topic article where there's patient experience, and when you continue care with them and you take and you provide the patients care in their own hands, how does it improve their outcomes? A bit about these references. Can anyone tell me, of you both, how has vaccines or how has medical imaging improved our health through the years? I'll stop talking now.
Uh,
And
uh, uh, Hello.
Yeah, you can go one at a time. Yeah, yeah. Martin, you
Okay.
want to start?
Yeah. Okay.
Mm-hmm.
I would say that vaccines have helped in the reduction of diseases that are reoccurring, like
Mm-hmm.
COVID. It's something that has come to stay with us, and more people are likely to continue to catch COVID. So, with
Mm-hmm.
the invention of a vaccine against COVID, it has helped to reduce the mortality rate. Um,
Mm-hmm.
Even when the disease is there permanently, now people can now, people are now vaccinated. Even when they contract the disease, they are able, the survival rate has become a lot higher now.
Mm-hmm.
Yeah.
Very good. Yeah,
and
very good.
then medication helps to reduce the risk of the illness.
Mm-hmm.
Yeah, like HIV, like for instance, if the
Mm-hmm.
person catches HIV, you know that because of the vaccination, it helps to reduce the risk and the danger of the diseases for the person to live a bit longer. Yeah.
Yeah, brilliant. Yes. Yeah, very, very, very important two examples, HIV and associated with vaccines. Medical imaging, for instance, you do imaging of let's say you uh, just do a random imaging of the breast for a female in her 40s, let's say, and she's got no symptoms, then probably you can catch a cancer that's there and that's hidden there, so that can lead to early treatment. Okay, and we know that these things are still evolving. There are new and new technologies that are coming into place, and they're all for improving survival and improving patient outcomes. Any questions? So please do have a read of these sessions, these readings, please. They're all on your Moodle webpage. And have a look at this video. I hope you've taken you've copied the link that I've shared with you. So if you have any questions, it's admin at sorry, ukversity.co.uk, so you can email them. Okay, so this is where you want to email and then ask any questions that you have. If you want questions, if you want to ask me questions regarding the session that I did yesterday, please feel free. You have all the learning, we've done the 2 learning outcomes for now. I'll stop recording the session. Sorry. So